back. I'm Michael Stamatinos, your host from the Advancing Healthcare Innovation Show. And if you're new to us, we're just crazy passionate about healthcare innovation and adoption. Our aim is to bring real stories of innovation within healthcare from real people. Look, we've got an action-packed year that's just some outstanding guests and amazing interviews that have been planned, ones that have gone forward, ones that we've done. So if you haven't checked us out, make sure you hit subscribe button. I'm just really delighted to connect today with Viveka Rydell-Anderson. She's an attorney, a healthcare executive, someone that really is about social impact, and she's doing some incredible work in the digital innovation space. Vivica, welcome to the show.
Well, thank you so much for having me. I'm excited to be here today. Yeah, it's really lovely.
So I think your story is fascinating for our audience that hasn't necessarily met you before. I think you kind of have some interesting tours of duty, as I like to call them. So would you mind perhaps even just kind of giving the audience a little bit of a snippet of your story, and we can kind of dive into some of the fun and interesting things that you're working on right now?
Absolutely, love to. Well, so I'm from Sweden originally, and I came here originally, went to college, and then I went to law school, UC Berkeley Law, and I spent 9 years in San Francisco doing antitrust law, and both litigation, mergers and acquisition, and then a lot of regulatory interaction with the FTC and the DOJ. And during that time, also always did a lot of pro bono work and Lawyers Committee for Civil Rights and social impact work. So in 2006, I was actually recruited by a Jones Day healthcare partner who was chair of a nonprofit, a public-private partnership, and they wanted to launch a new healthcare service. And he knew I had a passion to help people, and this was to help children. And so I ended up being the person who raised more than $10 million to get it started, building out a surgery center, integrating medical and dental care, and did that, brought it to sustainability. And after 14 years of that, realized that I could only have a much bigger impact if I also learned a little bit more about data in healthcare. And so I'm currently at Stanford Medical School getting my Master's of Science in Clinical Informatics Management, which just means like, how can we do data-driven healthcare, and how can we use that, whether or not it's digital healthcare innovations or within a healthcare system or telehealth. So I'm very excited to continue my path with having a big impact so people have access.
That's awesome. So you said a few different buzzwords that really resonate with me, access being one of them. I'm curious, in those different phases of your career, how has the way that you define innovation, has it evolved? And what is that definition today? How do you define it today?
Define innovation? Well, innovation for me is a lot about curiosity and be always having your eyes open for new things and asking questions like, why does it work like this? Why is this broken? What could we do? And just kind of be open and curious about what other people are saying to you and listening. So there's a lot of that curiosity in the listening. I think what's similar when I was a lawyer and did a lot of work with pro bono work, just wonderful to see kind of the innovations happening out in the community, both what partner agencies were doing, and then young fellows coming out of law school wanting to do a 2-year project, whether or not it was at a tribal land or in the Central Valley or an urban underserved area, and really getting that when you find a person with a spark in their eye and they know kind of, this is how I can fit within another great nonprofit agency out in the community. And that magic happens when people come in with new ideas. And so I think that part was innovation. Certainly leading the surgery center for 14 years, the innovation was constant in terms of the community health workers and the promotoras coming with, this is what the families need now. This is given events in our community. There had been some disasters. This is what we need. We need to step it up on transportation assistance. We need to step it up with food. And there really wasn't it wasn't whether or not we could do it, it was how. And I think that's the other part, is that the innovators, they got the curiosity, new ideas, but also you don't worry as much about, can it be done, but just how can it be done? And if it didn't work the first couple of things you tried, then you try something different. So I believe a lot in that as well.
That's great that you talk about that level of curiosity. I'm wondering how that balances out with your, being an attorney, being a practitioner and understanding policies, laws. Does that help you in terms of mitigating risk and then deciding which areas to innovate in? I mean, walk me through sort of like a even just a use case as to how you're using that one side of your brain, and then you're using that curiosity portion of your brain. I'd love it if you could maybe even just any kind of example, whether it be historical, or even one that's, present and, that you're working on now.
Oh, that's great. Well, so I would definitely say, as a lawyer, obviously we are trained to read a lot of different, a lot of text, and we can take in a lot of information. When I was an antitrust lawyer for 9 years, I worked in a lot of different industries, whether it was banking or automotive or trucks or healthcare. And so kind of the intricacies and highly regulated industries. As a lawyer, I have that training of I can navigate the regulatory system. And it's people, right? I mean, it's knowing what the rules and the regulations are. It's also having those relationships, whether or not it's with your legislators or the people at the agencies, on a long term, not just when you need something with them, but just think about it more of keeping them informed about what you're doing, what your client is doing. And so that's kind of the structured way. They don't have a lot of time, so you have to just break it down. 6th grade level is good. Bullet points is good. And that has transitioned really well into my more business strategy, being the CEO of a surgery center, and then also launching some other use cases in my last, with a tech startup, in terms of having those 3 bullet points of what value you bring to the client. And so it gives you that structured thinking. So you take a lot of intricacies, but it doesn't overwhelm you. And then you're able to present something really succinctly. And 3 bullet points is good. And then bring people along, and that storytelling. I mean, most of you, if you've seen TV shows with lawyers, right, telling that story and be very compelling. We have to do that in healthcare as well, because otherwise it can be overwhelming.
Have you share some little wins? You talk about the power of 3 and keeping things extremely simple. And as you know, healthcare environments they have a lot of moving parts. They're very, very complex. And you kind of have to meet people where they're at. Can you draw upon an example that you had that maybe where you use that simplistic approach and you're able to kind of really cut through a lot of that noise? Because it seems as though there's a lot of talk about innovation, and yet there's a gap between innovation that's happening and then innovation that's been deployed, and then successes that have occurred from that. I'd love to maybe even just kind of get some high points, some color around that, and your thoughts on that.
Absolutely. Well, I would say one is to see where you fit in with your innovations. So, is this going to bring value to the health insurance company, or to the providers, or to the patient? Where is this really fitting? So you need to see yourself where you're on the landscape. So I'm going to give as an example for some color. The surgery center was definitely something where we were taking a unmet need for children with severe tooth decay on Medicaid, who needed some care, that it wasn't efficient to do it in the hospitals. So for the hospitals to use OR time for a dental case doesn't make sense. And so they were losing a lot of money on community benefit, but also it wasn't efficient, and the children weren't getting the care, basically. And so a lot of children with severe tooth decay, and you can die of that. So that's a big problem. And so stepping away from that and saying, well, who else is in that Medicaid space, and realizing, well, there's the hospitals, they can't deal with when it's gone too far, and the dental and medical is separate. There's also the federally qualified health center. And so seeing kind of, they have the dental day-to-day, the hospitals are really for other medical conditions. And so if we have the surgery center, then the federally qualified health center, so that would be a clinic in your area, they can then refer to us at the surgery center. So I'm just giving you kind of that landscape. And for then CMS, at one point, we had this problem where there was a 10% cut in Medicaid payments, but all the federally qualified health centers, so that's like the national system of health centers, they were exempt from these 10% cuts. But the surgery center was not exempt because we were unique. There was only one of us in the world, in the United States. And so being able to tell that story to CMS and tell them, yeah, we are standalone surgery center, but all these health centers from 33 counties are referring to us. So it makes sense for us to also be exempt. It took about a year, but I think, again, when you explain the pieces of, this is how we fit in. This is what hospitals are good at doing. This is how their resources are best used. This is what can be done in a dental chair. And this can be done in, luckily, ambulatory surgery centers for a lot of things, knee replacement, hip, things like that is being used more. But when it first comes, so it's everything being at the frontier. And that's where I see myself now as well, having worked really with the emerging tech that's happening, whether, the AI, machine learning, blockchain, all these, the things, all the, the digital innovations. It hasn't been done before, so you really have to explain this is the unmet need that our new service is going to meet, and this is the value. This is how much better the patient outcome is going to be. This is the savings in dollars, and then you kind of bring them along on that journey.
So the art of storytelling is how you've been able to influence people to move to that next stage. I'm curious now, how do you plan on using data? I mean, we all know that data is, as you mentioned earlier, it's siloed, it's in different places. Do you find that sometimes it's a question of we have too much data, we don't know what to do with it, or is it more or less, what question do we really want to answer? Where do you find that there's a friction? Is it in too much data and being overwhelmed, or is it we don't really know what we want to really know?
I definitely think it's the overwhelm, that there's so much coming at us, and then the discernment is that piece of we have to step back and say more data isn't necessarily better, but it's stepping back and again, kind of at the back of an envelope, but just like, and this goes into strategy, whether or not it's preparing for a lawsuit, or it's building your business case when you're pitching a VC, or when you're talking to the regulators and try to get your reimbursement code. All of it is to always say, these are the key metrics that you are interested in, and we have tracked that, and this is how our solution is meeting those, because you don't need everything, and you need to really distill. So again, that discernment of what is it that's really going to be the key thing that's going to be making a difference. And so you don't want to throw it all. It's not like throwing spaghetti at a wall and seeing what sticks. That's not going to work. That's not going to work. And I think that can sometimes be overwhelming for people. But again, I think the training at Stanford Medicine has been really great in this, in terms of like, step back a moment and think, what is it you need from the data? And you have to kind of set that model up and realize that, and not just jump into it. And because then it can be overwhelming.
Yeah, I mean, think about the environment that any solutions provider is going to be selling into. You're talking about an environment that is generally reactive. And do you find that it's difficult to kind of really walk alongside, meet your potential partner where they're at, and to have them kind of take a step back when they're just so reactionary? I'm just kind of curious as to even the thinking behind that, because I get it, from a theoretical point of view, but when they've got bullets firing at them from all different areas, just how difficult is it for them to really take a step back? And what have you done historically to kind of get them out of that frame of mind where it's just reacting, but then it's just like, all right, let's think strategically here, a couple of steps ahead. I ask that selfishly, but I'm sure there's a handful of other people that are listening to this that would love to get your thoughts on that.
Well, I think always think about, you're an expert in what you are, your idea and what you want to do, and think about it that the first time your audience hears it, it's just, they don't really understand it. I've never heard about this. So it'll probably take you 3 times to explain what your benefit is. And again, keep it short, have a patient story of, this is the problem, this is the unmet need, this is how our solution is meeting that, and this is the value to you. And again, better outcome for the patients at lower cost. That's every time. And so again, you come into it, you're so excited, and you think they're going to remember you. You're going to have to come back. So for sure, at least 3 times, probably more. And then have the patient story of like, oh, that makes sense. Oh, I'd never thought about that. And so you have to paint that picture of, whether or not it's a person who's an amputee who doesn't have a socket that works for them so they can be mobile, or it's a young woman, a mom who's had a C-section, and she managed her care, managed her pain with Vicodin, and nobody had really helped her manage her pain. And so our solution is going to make it so that she's not going to be become addicted, but we're going to manage pain in different ways. But you have to tell the story, and so that the patient's story, and then remember, just because you're an expert in it, the person on the other side, and this is even so now a lot after COVID, and there's so many different startups, right? So it's, what's that addressable market? How big of a problem is this? And what chunk of that problem can you solve for them? So it's always, I'm here. It's not one more gadget. And I think that's what we have to watch out for, is just, we need to really, for me, it's a big goal to reach, people who aren't getting the services right now. So we make sure that the digital innovation isn't just making the digital divide even bigger. We have to make sure that everybody has broadband or access to Wi-Fi, and everybody can get that literacy, and so that we don't get a bigger divide between the people who have and those who don't. And because we know the health of everyone is going to be very important. But again, you're going to have to come back more than once, and you have to be very clear about, this is how much this is costing you in an inefficient or not being solved at all, and this is how we can solve it for you. And you support that with the data, because you said this is similar to this other industry, or when we tested it, maybe it's in a different country it's been tested, maybe you have some studies to refer to, and then you have to have that data to back it up, and can't just make the promises without the data.
Awesome. So I mean, I know that you're kind of wrapping up your training at Stanford. What has you most excited? What are you kind of chomping at the bit to kind of sink your teeth into, to the degree that you're actually able to share, and whatever is non-confidential?
Well, for me, the international collaboration has been really amazing. I think COVID, in a way, brought us all closer together, that the whole world was dealing with the COVID pandemic, and all hospital and healthcare systems around the world have had to realize what their weaknesses are and what's not working. Burnout among clinicians, and I'm thinking the whole care team, if it's medical assistants or nurses or doctors, everybody is just, they're overburdened, and we need to address that. Elder care is huge, addiction is huge, mental health is huge, and we have to address that. And I think, in my experience, having been in this space for a while, we were a little bit more divided, and like, well, healthcare works like that in England, and in Europe it's like this, and in the Nordics it's like this, and the United States has its own. I think what I'm really excited about, and what I'm seeing more, and I'm also involved with a femtech incubator in Sweden, is the ideas between our Silicon Valley and California innovation, that whole ecosystem, together with other ecosystems around the world. I think we can do some amazing things. I've done some work in Kenya, and then just as an example, again, solutions out there with community health workers and certain apps, they don't have they don't have as much of an infrastructure, and they don't have as much invested in those kind of electronic health records and things like that. So they've had to come up with some other solutions. So I think post-pandemic, we can learn a lot more from each other than I think we would have thought before the pandemic. So it's like one little silver lining. So I'm very excited to work on that international collaboration.
Yeah, it goes to show that not always is innovation have to be technological. An innovation and advancement can be in a process improvement. And at the end of the day, we are in healthcare. This is sort of the human factor that, sometimes, at least maybe from the innovation community, might get overlooked and saying, well, this technology is going to help with this and X, Y, Z, and we're going to automate this. And to a degree, I get that. Absolutely, it's very, very viable. And let us not forget why we're here. We're here to serve people. We're here to serve those that are often overlooked. And you mentioned access, a handful of different times. What are some other kind of final thoughts for you around this notion of access? It just seems as though that social determinants of health, it's getting a lot more attention, and rightfully so. If you were to kind of take and again, not asking for the end, the panacea here, but if you were to take a three-step approach, keeping things super simple, I mean, how do we kind of bridge that gap where there is a lack of access in certain areas, whether it be urban areas or even inner city areas. How do you approach that, through innovation? Give us your best answer.
Absolutely. Well, no, I will say, I will just as an anecdote say, I think a couple of years ago, I was in Chicago, and there was a healthcare conference going on, kind of more healthcare executives from big systems and health insurance. And then there was a health equity policy summit going on at the same time. And it's now finally those two worlds are starting to merge. But of course, we have to move into where prevention is being paid for, right? And so you need to align the incentives that we definitely have to go to value-based care. Prevention has to be part of the packet, because otherwise we're just going to continue to have healthcare where it's just treatment afterwards that's being paid for. We need the prevention education and all, and building up so that everybody has access to transportation and healthy foods and safe environments to be in. And so I think I like to, Simon Sinek and the why, remember why you're doing it and go for that. You can't solve all of it. And so social determinants of health is your passion. Always speak up for it. We're having a HIMSS Northern California panel happening in April. I'll make a plug for that, but it's a learning journey for all of us, but we have to keep demanding that we want it because nobody's figured it out completely. But, it's like we have lessons to learn from each other but keep at it. The big thing I want to say is also Stacey Abrams. I'm a big fan of her. And I think it's like, figure out what you want, why you want it, and how you're going to get it. And so if you're dedicated to wanting to figure out the social determinants of health and approaching that in your community, you're probably going to have to look outside of the walls of the hospital system. And who are those partners that are good about in food security? Who are the ones that are doing it magnificent, and partner with them, because we're going to have to do it. But it means we have to, instead of just looking inside and what's our bottom line for our budget, we have to say we are committed to this. And I think the more we step up, you've seen this shift a little bit in corporate America also with, international, really with ESGs and, I believe this commitment that we make, it means we have to shift things. And so it's going to be a relationship between things in academia, corporations, and also government, and how the reimbursements happen. We have to align them. We have to stay committed to that. So I think it's not something we're going to do overnight, but I've seen some really cool, I'm going to shout out to City Block Health. I think they really are taking a stab at this, and we have to keep pushing. And so I know from the surgery center, we did something that nobody thought could be done. You can't just see these Medicaid patients and then special needs patients, but it can be done, but you have to show the value and what it is. You have to commit to say, this has to be done. So we have to find a way, because the cost of not bringing everybody along and not letting everybody be healthy is too big. And that's not the society we want to be.
Your level of conviction is super encouraging. I get the sense that if you got behind something, a lot of people would follow you. So I think that's just your way of telling a story. So I just want to commend you for that. It's really, really nice just to be able to connect with other people that truly, really deeply care, and that it's more meaningful. And don't get me wrong, healthcare is a business here in the US. It's, if you don't have any money, then it's hard to fund a mission. I'm just interested in, and there has been some talk around this, where health systems are viewing some of these innovative technological companies, whether they be virtual care, as a possible competitive threat. And I think you mentioned it earlier, is that you really kind of have to understand what's happening in the market. So does that mean that we need to do a better job as the healthcare innovation bucket of letting them know that we're not there to compete against them? We're there to kind of align with them, but there also has to be that financial incentive. So it seems like as though there's a real fine balance there. And any words of wisdom around how to potentially craft a story that really aligns those incentives, despite that not everyone is on a value-based care or risk-based contracts. Very much fee-for-service is very much here still. Curious if you want to kind of give any kind of parting thoughts around that concept.
Absolutely, and I could talk about this all day, but I would say the thing is, the reality is the healthcare systems, if we then think of the brick and mortar, they're buckling under from having to do things that aren't necessarily the thing they're best at, right? So we say healthcare system, you're good at these operations, you do this, the care that needs to happen there. But they're also getting people coming through the emergency room doors, or they're also like, the reality is, so we as innovators have to partner with them and say, listen, invest in us. And I'm going to say this from my experience, like if you invest in us, then you will have a place to send those patients that you are not the best able to do. Same with telehealth. Maybe you're not going to be the best, you don't have the best interface for how the patient can easily schedule appointments. Well, we have that interface and we'll partner with you. And in exchange, we will refer those cases to you that you have the specialty care that you know how to do. And so I think solving the physician burnout, you know, a lot of it is if it's misaligned and people are spending time on things that aren't really, you know, top of the license, kind of the term, but it's just, you know, I think we need to bring in the people who can help you with that. And if it's, you know, community health workers in the community, it's caseworkers, social workers, so that the nurses and the doctors can do, and the surgeons can do what they're best at. But our system right now is everybody's having to do too much, because we've been really bad at partnering and saying, I know exactly efficiently how to send this patient here because they need it. And one way to do that is tracking the data. I know this is a patient who's probably going to be a no-show because past evidence shows that. We need to address how can we get them? How can we do the hand-holding? And the hand-holding is not, you know, it just makes sense. And I find a lot of times the hand-holding and getting more education, we on private insurance get that. And it's just a lot of the Medicaid patients are not getting that. And so we need to see who does what best in the area, and then helping each other out. And then I think we can build a thriving ecosystem. And healthcare is very broken the way it is now, but I think we'll have to partner and be clear about, this is what I do best, this is what you do best, and let's partner. And so I think that's how we can get there. Awesome.
Well, let the audience know how they can follow you, your work, and some of the things that you're putting out on social media. Just, you know, take a few moments and do that, and then we'll wrap up here.
Absolutely. So I'm on Twitter. It's Rydell, R-Y-D-E-L-L, Vivica, V-I-V-E-K-A. I'm also pretty active on LinkedIn, Viveka Rydell-Anderson, R-Y-D-E-L-L-Anderson, S-O-N. I'd love to reach out, love to hear from you, chat more, and always happy to speak about healthcare. And I love mentoring people, and just, yeah, reach out to me. I'd love to hear from you. On email, it's vivica68@stanford.edu. And yeah, look forward to meeting people.
Great. Well, Vivica, this has been fantastic. And for the audience members, if you found this content helpful for you, would you mind sharing it on social media, or even just liking it, commenting it with your network? I'm just so grateful when we have folks that can come on that truly want to make a difference. We have an amazing community of people that really, truly want to drive healthcare forward, and bringing in more innovators that are action oriented, not just talking about it and sitting in meetings and then just talking about it and sitting in meetings. I'm talking about folks that really want to do things and make things happen. It's fantastic to be a part of a group like that. So Vivica, appreciate you coming on, and looking forward to our next conversation.
Well, thank you for having me, Michael. Always love talking to you.
Likewise.
Bye. Take care.